Good afternoon, everybody. I am Riddhi, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping in good health. Today, we are going to discuss a very important topic, that is skin healthy with focus on urticaria or hives, which we or our near or dear ones would be encountered at some point of time. Urticaria is characterized by round rash on the skin that itchy intensely. It may due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per the study published in India Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one point of time. 60% of the patients are in the age group of 20 to 40 years. Incidence is higher in old age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or a blessing if we get to hear from our expert dermatology online about urticaria and its type, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Aditi Dalvi Deshpande, is MBBS, MD dermatologist and cosmetologist from Rene Advanced Skin and Hair Clinic, Mumbai, Maharashtra. She has years of experience in the field, and her skill and compassion have made tremendous difference in patients' life. A very warm welcome, Dr. Aditi. It's a pleasure to have you join us today, as we are going to discuss about on very important topic, which is the management of urticaria. First of all, I would like to ask you, what is urticaria?
Hello everyone, I hope everyone is fine. Urticaria is a problem in which you get rash, which is like temporary. For some time, the rash is there, which is like reddish elevated rash. Initially, it is followed by itching. It is first, it is there is a little bit of itching, and then it is followed by a rash. It can appear any part of body, all over body, and it is quite disturbing to the patient. Basically, urticaria is a response to any allergy that can be there from the causative agent.
Doctor, what are the main causes of urticaria?
Okay, so basically, there are many causes of urticaria, and it is very difficult to find out what is causing it. Generally, the most common is due to drugs, the medications that we take, like simple painkiller or even a simple NSAID can cause it. Then there are a lot of antibiotics which aggravate it. So, antibiotics and painkillers are the main culprit. Other than that, it can happen if you have any internal infection. So generally, when patient has sore throat, when the patient has fever, then it is followed by urticaria, which is quite common. Then it can be due to the external environment. So as we know, our lifestyle has changed, our surrounding has changed. There is a lot of dust and construction going on all the time around us. So the dust mites, even the dust, the pollens from the trees, the dander from the pets, they can also be the important factor. Along with that, there are other few causes of urticaria. Not to forget first, which is very commonly, patients or people feel that is the most common cause, which is the food. So in food, due to our lifestyle changes, we indulge in a lot of outside food, packet food, preservative food, and the food with lot of color, especially Chinese food. So these are the foods which mostly aggravate. Apart from that, in non-vegetarian food, shellfish is the main trigger, and sometimes it can happens with eggs to somebody who is prone to it.
Yeah.
And then other causes which are there, were mostly due to external environment, are something like an insect bite. So if you get a mosquito bite or a sting, then it can happen. Then it can be due to external environment like sunlight. Some patients get urticaria even after excessive cold temperature, excessive hot temperature. It can also be due to water, which is also called as aquagenic urticaria.
Hmm.
So, and then there is one which is the cholinergic urticaria, which aggravates with stress.
Yeah.
So that is also very common. And even the last one is the pressure one. In
Hmm.
that, if you are under, if you are wearing a tight clothing, or if there is too much pressure on your body, then you develop it. Mostly happens when we lift weights in the gym.
Hmm.
That is that these are like few of the causes of urticaria.
Oh, thank you, doctor. How does urticaria look like? Is it an allergy kind of?
So, as I said earlier, initially you get a sensation of very strong sensation of itching all over the body, and then it is characterized by the small red colored elevated rash. It
Hmm.
can be very small rash or it can be a little big rash.
Hmm.
And the rash is quite different from other allergy because it subsides, it reduces on its own in less than 12 hours or maximum 24 to 48 hours. It doesn't stay long.
Okay.
And that is like a characteristic feature that we have to see.
Hmm.
Sometimes with urticaria, you also get swelling because if it is deep, like you get swelling around your eyes, then you get swelling on your cheeks, your full face is swollen, and sometimes it is in your throat. We call it larynx. So then the breathing can be a difficult issue, and that is an emergency. That is something you should never ignore, and immediately you have to consult your dermat for that.
Yes. Doctor, is urticaria a serious disease?
Urticaria is a chronically serious disease. That is, it is something which takes a little longer to reduce or go, but it is not something to worry about. It
Hmm.
is not very serious, and we can definitely control and slowly get rid of it.
Mhm. Yeah. Doctor, as you mentioned earlier about the lifestyle, so there are individuals who prefer not bathing and they sweat a lot. And
Hmm.
just because they are not doing any outside work, they prefer to skip bathing and just stay home indoors.
Hmm.
So, is it possibility that they might have higher chances of getting diagnosed with urticaria because of sweat and unhygienic habit?
Sweat and unhygienic habit can definitely cause some infection to them.
Hmm.
Maybe fungal infection, which is very common because we don't, if the patient is not bathing, he might have fungal infection. And if that is extensive, we have seen patients with fungal infection complaining of urticaria. So the personal hygiene is very important
Hmm.
because when you take a bath, when you clean your skin, there are
Hmm.
a lot of allergens or dust on our body which gets washed off.
Yeah.
So it becomes, much better prevention if you keep yourself hygienic and bathe daily.
Yes, I
Yes.
think the viewers who are listening this might get notified that they should actually have their proper hygienic habits and have to do bathing every day. What are chronic urticaria hives? How will they go away?
Okay, so basically, urticaria is divided into acute and chronic. So
Mm.
acute is something which resolves in about in 6 to 8 weeks. So
Mm.
when like there is anything causative, there is some cause, and the urticaria comes immediately, and it gets reduced in 6 weeks, like 1.5 months. But sometimes it continues for more than 6 to 8 weeks. Then we call it chronic urticaria.
Mm.
So chronic urticaria, unlike acute urticaria, there are again two types. That is, one is chronic idiopathic, where there is no cause. We don't know why it's happening. And then there is other called as chronic spontaneous, in which we can see that there is a genetic history. That is, their parents, they have a tendency, or they have an autoimmune problem. That is, they have some antibodies in their body
Mm.
which is causing urticaria.
Okay.
So it is something that is in common term, if we call, that is, some people have a tendency to develop urticaria.
Doctor, what are the potential complications of urticaria if left untreated?
Like I said earlier, angioedema, is something which is worrisome, because there can be difficulty in breathing, and patient can land up in ICU because of that, because your the larynx and the throat and everything gets choked.
Mm.
So it can be life threatening. So if you develop angioedema, it is something which is problematic. So that is one complication. Along with that, there is another thing called as vasculitis.
Mm.
So in vasculitis, your blood vessels are also involved. So it is little deeper and more inflammation, and the rash doesn't go away in 24 to 48 hours like the normal urticaria.
Mm.
So that complication can also happen. Yeah.
Okay. Doctor, as you mentioned that about something about stress in the lifestyles, can urticaria be caused by due to stress? And if yes, how do stress urticaria look like?
So yes, urticaria can be caused by stress. The chronic ones which we are talking can be aggravated by stress, and it looks the same like urticaria, but there is a triggering factor, like the if the person is under a lot of stress,
Hmm.
physical or emotional. In females, we see it before the menses or during the menses, because at that time our body is going through a lot of stress. So
Yes.
urticaria is common during that time, and even when the like the patients are under a lot of stress,
Hmm.
if office related or emotional, then the urticaria comes. It is mostly seen at night time. Urticaria generally appears mostly at night time after dinner, when the patient gets to sleep, and it aggravates more in early morning. So that is like the common time when you develop it.
Okay. Doctor, as you mentioned, as why do hives or urticaria get worse at night?
Yeah, because the inflammatory markers and the all the inflammation, it increases during that time.
Hmm.
So our body physiology is such that the inflammatory markers are released more during night time. So that is why it happens.
Mhm. Does urticaria make you tired?
Yes, definitely. It makes you feel little fatigued. Makes you feel little irritated.
Hmm.
Irritated is something which is more likely compared to tired.
Hmm.
But the medicines, the initially earlier those medications which were given for urticaria, they used to make patient feel little tired and little sleepy. But right now we have many other good medications available which doesn't do that.
Okay. All right. Is there any dietary precautions or do's or don'ts for patients of urticaria?
So see, diet plays 5 to 10% role in the urticaria, and what happens in patient gets very cautious about diet, and they skip many of the ingredients in diet. So I want to tell the viewers that please don't do that. Diet is only one of the cause, not
Hmm.
the only cause. So don't skip too many ingredients, because then you will be losing on the nutrition part.
Hmm.
Just try to see what is causing urticaria in your case. You keep a track. We tell our patients to maintain diary,
Hmm.
and generally the foods which causes urticaria in my practice I have seen, first is outside food, especially the Chinese food or the packet food, and that is common. Then the shellfish. Otherwise, in vegetarian source, it can happen due to potato, due to tomato, very sour things or very spicy things.
Hmm.
After pani puri, we have seen it happens. So those are the more triggering factors. Anything which is too sour or too spicy, and outside packaged food and Chinese food.
Hmm. Does urticaria contagious?
No, it is not at all contagious.
Okay. Can COVID cause hives on face?
COVID is did cause, when there was a first wave of COVID, we were seeing a lot of patients with urticaria. It is because COVID is an infection. So
Hmm.
urticaria happens because of infection. So even COVID vaccine had caused many cases of urticaria.
Mhm. Doctor, what are the preventions and precautions one should take if person is diagnosed with urticaria and is with a mild disease, not too severe to visit a dermatologist? So, what are the prior things and precautions they should do when they feel like they are diagnosed with urticaria and it's very mild?
Yeah, so generally, what precautions I tell my patient is first, clothing, wear very loose fitting clothings and cotton and airy clothings, that will also help. Second, avoid strong perfumes and strong odor, something like they should skip agarbatti or odomos at home.
Mhm.
Third, they should avoid going out where there is a lot of dust, and they can skip the construction area.
Mhm.
Then avoid handling of pets, because sometimes pets are also the cause of urticaria. And last, just keep a track on your diet.
Mhm.
Don't indulge in something which will cause urticaria, like I previously said.
Mhm. Okay. Thank you, doctor. What lab tests are needed and why?
See, if the patient has acute urticaria and we know the cause, like if the cause is any medicine, or if he has fever, then there is no requirement to do the test. Especially in acute urticaria, we generally don't do the test, because it is something which will reduce on its own only with the anti-allergic medications. But if the urticaria is a long term, then we do test like a complete blood count. Then there is something called as the ESR. Then we do some tests to check whether he has autoimmune. So we have IgE, anti-TPO antibodies, and so on.
Doctor, what are the treatment options available?
Okay, so the treatment option generally, what we do is first we start with antihistamines, that is the anti-allergic medications. So they are given twice daily, and the patient has to take it for a little longer time, maybe 1 or 2 months. Generally, if the course is done properly, slowly we reduce the medication and then stop it. So first step is anti-allergics. If not, then we go on to little stronger medications.
Okay. Doctor, your session has been very informative and viewers are pouring with questions. We have Rahul Bastwar, whose question is, when should I seek medical attention of urticaria and what test are or diagnostic procedure might be necessary?
So, Rahul, if you are developing urticaria on a daily basis, and if it is affecting you emotionally, if you're getting very irritated, and socially also you are getting irritated because of that, and if it is not resolving on its own, uh, at least for 15 to 20 days, then definitely you should visit your dermatologist. And your dermatologist will take your history and probably let you know which test to do. It is better for them to tell you which test you should do, because self testing or self medicating is something that we don't advise.
Thank you, doctor. Doctor, is urticaria a lifelong disease?
See, it is a chronic disease. I have seen half or maybe 75% of my patients getting rid of it completely, only and only if they follow the proper medications which are given for a longer period of time, ranging from 3 months to 6 months to a year also. But if you take medications regularly, yes, you can get rid of it.
Thank you, doctor. Doctor, we have Millie Agrawal, whose question is, what are the available treatment options for urticaria in adults, both for immediate relief and long-term management?
So immediate relief, as I said, we start on antihistamine, something like, you must have heard the names of Allegra or cetirizine. So generally, according to the patient's medical history, and after taking a proper medical history, we start that. And sometimes if the patient has acidity issues, we start antacids also, because that is also something which is very common in urticaria patients.
Hmm.
And for long term, then we tell them to take precautions, maintain a diary, to see to find out by themselves because they are the best judge to see what is causing urticaria.
Hmm. What is the best treatment one can do if they are with a severe chronic? Because sometimes it happens that an individual is not able to take medications because of the allergy. So it is something like that, that one person is diagnosed with urticaria and has a skin related issues also having a medication. So some have allergy also. So
Mm-hmm.
that cases, what do you do?
Uh, See, basically, if you have a skin problem, you are almost on an anti-allergic or anti-itching medication. So that should help with urticaria. And basically, what we do is if we change the molecule, we change the medicine. If some medicine is not working for you, then we increase the dose or we change the molecule. And if not, then there are other immunomodulators that we start according to your medical history. So there is one called as updosing the current medication or changing the medication. That also helps.
Okay. Doctor, what takeaway advice would you like to give all our viewers?
Takeaway advice I would give is like if you suffer from urticaria, it is important to visit your dermatologist and please don't self medicate because it will be something like half knowledge. You're just half treating yourself because we as dermatologists we take your proper history, we find out what is causing it, whether it is acute or whether it is chronic, and what medications will be suitable for you according to your age, according to your weight, according to your occupation. So very minute details are there when we take the history, when we give the treatment. So that is why it is very important that you consult your dermat at least once, take their advice, start the medicines, continue the medicines which they give, have faith on them, and then you will definitely, get rid of urticaria and you will have a very, happy and itch-free life.
Yes. Thank you, doctor. As you mentioned earlier about the diagnosis, do diabetic patient or obesity patient have the higher chances of getting urticaria?
Studies have not shown any correlation with diabetes or obesity. So, yeah, so the take home message is that, consult your dermatologist if the urticaria is very severe, is one. Then make some lifestyle changes as discussed earlier. Avoid the foods with color or too frequently eating outside food should be avoided, and take maintain a healthy lifestyle. That will also definitely help. And diabetes or obesity is not directly linked to it, but as I said, it is better to be on a healthier side.
Yes, yes. Thank you so much, Dr. Aditi Dalvi Deshpande, for your valuable time. It has been a very informative session for all our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And if they get to see such symptoms, they know what they have to do instead of self-medication. It's better
Yes.
to approach a nearby dermatologist. It's great to hear you, and we are really looking forward for many more such sessions in the coming time. Thank you, viewers, for your participation in today's sessions, and get latest updates on how to keep your skin healthy. Do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you so much, doctor. Thank you, viewers. Have a great day ahead and take care of yourself.